Back again, the Healthcare Committee. We want to continue our discussion with the rural healthcare access. And I believe we have three people here. Kelsey, Lila, and Amanda.
We'd all be together. We'd like to be
Yeah.
together.
Yeah.
I think it's good.
Yeah, my favorite thing.
Kristen, are you able to send me the link for the house up here? Sorry.
Who's going first?
All
You go first.
right, great, I'll get this done.
Okay,
Yep.
so I start?
Go ahead and start. Good morning.
Good morning. Thank you very much for having us and me here today. And listening to my testimony regarding how recovery is an imperative component to rural health. My name is Lila Bennett. I am the Executive Director of both Journey to Recovery Community Center Newport and Newport, Vermont, and Ben's House, a new sober living and workforce development program we have recently opened in Derby, Vermont. I'm here today to share the systemic successes we are having in the NEK community, why it's working, and then to ask you to consider helping us expand the systemic solution across the state. We are working hard as collaborative community partners to meet people with the level of care they need when they need it. This is ever changing and it requires systemic support. It requires being intentional and dedicated and safe and smart and nimble and willing to push back on the systems that have consistently failed and then strive hard to do better. Journey to Recovery is a peer support recovery center, one of 14 in Vermont, and we are part of Recovery Partners of Vermont, an organization that supports recovery centers to offer consistent and effective care throughout the state. Now, because it's NEK Day, I have to tell you that I was a farmer for over a decade before I stepped into this role. I was a farmer for a couple of reasons. I cared about rural landscape, I cared about local economy, and most importantly, my husband was an alcoholic who could not hold a job. And with 3 young children, I could not safely leave them to go to work. I was a teacher. And I wanted my kids to understand how to find a career with purpose. So I chose farming. It's questionable.
It has purpose.
But what it really taught me is that you have to have precise working systems in order to be successful in anything. Creating systems is what we have been doing carefully and step by step in Newport. I stepped into the role in April of 2020, which was COVID. This meant that we could not see anyone in person unless they were in the emergency department in severe substance use related crisis. And it was taking over 30 days to get anyone into inpatient treatment. Also at the time, the staff I discovered at Journey were actually in crisis themselves. So it left me to be a one-person center during COVID with only a phone to talk to people, and people were dying on the other end. So calling people to try and get them to treatment and feeling them lose hope instead of gain hope day after day was unacceptable to me and also traumatizing. Hospitals are not detox centers, and nor should they be. If someone is medically cleared, they are discharged back to the environment, triggering them to use. And I kept track of this. The numbers of people discharged, relapsed, then back to the ED before getting to the next step, which is really expensive. One client went to the ED 13 times before we were able to get her into treatment. And then with the help of our accountable healthcare community, Vibrant One, which stands for Orleans Northern Essex, these amazing people and more, we hired a consultant to do a needs assessment and took the data and determined that having a stabilization bed or a social detox bed would close the gap in our system. This would reduce overdose deaths, alcohol deaths, repeat visits to the emergency department. And we learned that medical detox is not social detox. And social detox happens after the doctors clear the patient. So in November of 2021, we opened our first in Vermont social detox bed. This has done a number of amazing things. It has taken people who are ready for treatment and offered them a place to stay with trained professionals, introducing them to the world of recovery, offering them dignity and hope and respect. North Country Hospital provides all the meals and linens still. We developed protocols with the doctors for exactly what criteria and procedures to follow. And not only that, we broke stigma with the hospital. When I first started going to the ED, I was kind of side-eyed. They were just really frustrated. Nurses and doctors are trained to fix a problem immediately. And that's not how addiction works. What happens when you feel hopeless, you get negative, and what happens when you don't understand something is frustration. So the nurses and the doctors were like, I can't do anything. So opening our bed gave the doctors and nurses a solution they could feel good about. And we reduced the burden on the hospitals. We were then able to explain how addiction works and doesn't work. It's not just like bad choices over and over. There's so much more to it. The relationship we have now with all the doctors and nurses, the CEO, and more, is one of absolute mutual respect and collaboration, and we really do work together. We all do our level best to get these people in crisis what they need when they need it. How do we measure the success? Well, since November 2021, and I know I'm talking a lot and I'm going to keep talking, just like, hold on. So we have supported 136 unique visits to the bed. We have 39 repeat visits to the bed. And what we can say about this is that when someone relapses after being in the bed, we aren't losing them for days or weeks or months. It's or forever. It's usually one day because they know to call us, they know to walk in the door, they know where to go to get help, and they know that they will be helped. Okay, 2 more pieces of the system. So we did all this work as a community to open the bed, and it works. We get from people from the hospital to our bed to treatment. By and large, this is Valley Vista and Serenity House. For the record, I can call Valley Vista 7 days a week, 24/7, and I do. And we are going to get an immediate response. They work with us to get people in right away because they understand that window of readiness is so small and time is of the essence. And Serenity House is a much smaller facility and cannot act in that same manner. We only have these 2 options, and Valley Vista can no longer take methadone patients right now. I had 2 last week that we were doing all we can to hold them while waiting for a screening at Valley Vista because they're on methadone. And it's still about 2 weeks for a bed, and one has a family and one is homeless. And we're actually partnering with Kelsey on the front porch right now to really work on getting this person the support that they need. So this is like community collaboration in real time. Like right now, this is what's happening today. Okay. So what happens after we get someone from the ED to our bed, then to treatment? Well, treatment, I think you guys have heard a little bit about like longer lengths of stay and that confusing, how long can someone stay and still bill Medicaid? It's a really confusing thing, and we need people to be able to stay longer. But once they get discharged, they get discharged right back to the same environment, triggering them to use, and it's the same thing all over again, except it's like even more expensive because now we just paid for treatment too. Okay, and so until this past November, we have not had any sober living in our community. We all know that people often have more success being near their families and supports than being shipped away, but we haven't had any options for sober living here. So we have been sending people to Maine and New Hampshire as there aren't enough beds in Vermont. Some people cannot go away, though. They have jobs and children. For the last 2 years, we've been looking at facilities and attempting to get funding to open a sober living in the NEK. Thanks to Don and Greg Tatro, founders of Jenna's Promise, they purchased the former Derby Green nursing home. It's now called Ben's House, after a gentleman named Ben who passed away, and his parents are providing financial support for the expenses. It's a sober living and workforce development program. We have 5 residents currently. They are living and working in the Northeast Kingdom. They are working and contributing now. They are also working with NKHS. They're required to work with Journey to Recovery. The program is a trauma-based program, and we are taking men and helping them learn how to address the pain that caused them to drink and use and become loving fathers and husbands and sons, while also becoming contributing taxpayers. We brought one of them yesterday to testify for Recovery Day, and I would be happy to share his testimony with you all because it is powerful. example of why closing this gap in the system is so imperative to rural healthcare in general. Okay, last thing, hang on. One more thing. So the next system gap we are closing with great success is prevention. So working with adults in crisis at Journey has made us beg the question, what is happening with the kids? What are they seeing, learning, and absorbing? The substance use crisis has been a crisis since about 1999. So this is severely generational now. And listen to me, until you work on the front line, you cannot have any idea how bad this is for these kids and how many of them it is. Did you know that in the NAPA, most kids are dealing with a parent with substance use? Vaping, Bud Light, twisted tea, drinking and driving, pills on the side just for fun. The onslaught of legal cannabis and the confusing narrative there, and then the crack cocaine and fentanyl xylazine situation. You have no idea how many kids are exposed to this every day, and they have been their whole lives. We have kids living in campers, trailers with holes in the floor, families who have never had a car in their lives, ever. Kids who the only routine they have ever experienced is the routine that happens at school. There is no family dinner, there is no chore list, there is no dreaming about how the world is big and bright. Kids are vaping here as early as 6 years old. How do we know? Because we realize that we can not only be reactive to the SUV crisis, we have to, and we have a responsibility to be preventative. So we started in North Country High School in the fall of 2022. We embedded peer coaches full-time in that school. We have gone from 53 infractions that year to 9 so far this year. We went from 30 interactions with kids in September 2022 to over 700 per month currently because kids self-disclose when they feel safe. We are now in Lake Region High School and 4 middle schools. We have middle schools in our area. We have 1 middle school in our area with 10 students who have lost a parent to overdose. And here's the thing, we don't tell the kids don't do drugs. We talk to them about in age-appropriate ways what's actually quite similar to what we speak to adults about in early recovery. It's trauma, it's self-worth, it's agency over their actions, it's how to have goals, what is peer pressure, what is success, what makes a good friend, what is good risk and what is bad risk, and what is a leader? Is being a leader uncomfortable? Yes, it really is. How do we deal with discomfort? We introduce attachment theory. We introduce the concept of trauma responses. We use evidence-based curricula for the science of substances, but you know what they want? They want someone to ask all the jumbled up questions they have about addiction, and we offer that, and it's working. And how do we know? The data does tell the story. We are in the middle of rewriting the policy and procedure at the supervisory level, including Journey here in the North Country Supervisory Union. When students are caught with a substance, they are suspended, but the days are reduced. The initial meeting will be at Journey to Recovery, not the school. Not only so we are offering a neutral environment, but it is a way to get parents through the door of Journey to Recovery. As we know, so many are scared and don't know where to get help, but will see the safety. We have already sent 4 parents to treatment who are engaged because of their children. We have 15 engaging at Journey because of the kids. Recovery is an integral place in rural health because we are saving people from relying on the system. We are teaching resilience and trauma healing from day 1, whatever that day is, 6th grade or age 60. I could keep going, but I have so many more pieces of the story. But hopefully I can walk away today leaving this impression that recovery saves lives. It closes the necessary gaps in the system. It teaches people the resilience they need to be able to contribute to society and not deplete it. Reducing ED visits, reducing repeated visits to inpatient, increasing the workforce, increasing students learning how to set goals and break the generational cycles of poverty and addiction. Also, I do this work because I was a farmer in poverty with 3 kids and living in the chaos of addiction, living on food stamps and struggling in the shame. And I got out and I understand how to do it and to teach children how to. And so, you know, the money that you will hear that we're requesting to increase for recovery centers and the $500,000 for the oral health and the $360,000 for recovery residences is a path forward. And I hope you will help us expand this systemic support throughout Vermont.
All right. Do you have, does your group have any connection with the Mentor Vermont program? Do you have any assistance with connections with? I can't remember that if it reaches up into.
The DREAM program has some action in the Northeast Kingdom. They're a mentor program that is statewide, but I haven't heard of that one. But
Me neither.
It's like there's a heavy emphasis in my county and Addison County and focusing on the idea that you matter and
Yes.
working with whether it's the mentor program or with your program, that very important feeling for youth feeling like they matter to somebody is so huge.
Are they using the You Matter program? Is that?
I think so, yeah.
Okay, so we work with CCSU, the school department, in Project Aware, and that's a big part of what they're doing. So that does sound familiar to the You Matter program, but I don't know about the mentor.
Thank you for your work.
Yeah.
Just didn't,
No, go ahead.
sorry. I just didn't understand, where's that bed located?
It's in Journey to Recovery Community Center, which is right across from North Country Hospital. So it's like, it's door to door. It's,
Awesome.
yes.
Yeah.
I'm waiting.
That's my question. Go ahead.
I wanted to go back to school suspensions
Yes.
and discipline. I'm concerned about school suspensions, period, but you said there was a way that suspensions were reduced. Can you say what that was?
So before we were in the schools, they were doing like a 10-day suspension, just a blanket suspension. So if you get caught with a vape or THC or drinking or whatever, you go home for 10 days. And we know like that's not effective because you're just going home to be sort of shamed and maybe with parents who are using. It's not reduced all the way. They're still doing a 3 or 5 day suspension. That has nothing to do with me really, but the reason is because they're trying to send the message of like safety. So if you come to school high, you're not a safe community member in the school. And so you cannot do that. But so there's like that message, but then trying to be restorative about how to address what's really going on. Like, why are kids doing this? And how can we open that conversation? And how can we actually get the root cause of what it is rather than just like, don't do that, because we know that's not working and it's just so complex.
So there's been an overall reduction in suspension time, just a blanket overall.
Unless the only reason that they wouldn't have a reduction is if they're refusing or their parents are
Okay.
refusing for them to work with Journey to Recovery.
Thanks. And can you, hold on one second. I just want to make sure I'm getting this question.
Because it's about what they're asking, the money part.
Oh, I was gonna say, can we go over the ask?
Yes, that's what I'm
A
curious.
little slower. So now recognizing, have you been into Committee on Human Services?
Yes.
Okay.
Oh, so it's going through, we don't have to go there.
Well, no, this is.
No, I'm not saying we don't want to know. I'm just saying it's not in our, if it's
I
there.
threw it in there just because it was an opportunity for me to get it in front of you.
Okay,
Um,
can you repeat it?
Yeah.
Yes,
Yes.
repeat it.
So it's 1.6 million for recovery centers across the state to be able to do similar work to the work that we're doing in the schools to help with healthcare increases, cost of living increases. And then it's $360,000 for recovery residences. And what that is about is it's a scholarship. So if somebody is homeless and they go to treatment, but they want to go to sober living, but they have no money, it's a scholarship fund to pay for the first month. And that's to cover everybody who would be in Vermont. Our home, it could benefit our home greatly. Like, we're just kind of like figuring it all out as we go. And the oral health is $500,000 and it's through the opiate settlement fund is what we asked for. And that is because we have so many people who need their teeth rebuilt, who have been in addiction, and they're perfectly capable, intelligent workers. And then they either have infections that are expensive and make them sick, or they are unsightly and they can't work in, you know,
Very important.
yeah.
Yeah, totally.
Great. Well, thank you. We do have to get to the floor. We have a
Oh, did
assembly.
I do that all the time?
You know, we can come back. I think our floor is only gonna be about an hour. If you're still here, I'm happy to have us come back at 11:30. Is that
Great.
something you,
Yeah,
I
that'd be
I
great.
would like to give you more time.
Yeah.
Okay,
So we're kind of separate things, like we're connected, but we are separate.
all
They
right.
have agendas too.
So let's plan on being back here at 11:30, everybody in committee, and so 5 minutes after the floor.
Okay, yeah.
All right?